Great. Welcome, everyone, to the Hariri Institute virtually for computing at Boston University. Thank you for joining us today. I'm Eshed Onbar, an assistant professor here at the EC department at BU. AIR, the Artificial Intelligence Research Initiative, is one of the Hariri Institute for Computing's initiatives here at Boston University. The AIR Distinguished Speaker Series welcomes researchers who are highly recognized for their work in the field of AI. We have asked our featured speaker who joined us today to prepare a 40-minute or 40 to 50-minute presentation, which will be followed by a Q&A session. So please hold your questions until after the talk. Today's talk will be recorded and later available on the Hariri Institute's YouTube channel. I would also like to welcome you to join us in upcoming speakers this spring semester, including Ravi Ramamurthy, Professor of Computer Science from University of California, San Diego, Andrew Gordon, Associate Professor at the Courant Institute of Mathematical Sciences and Center of Data Science, New York, James Zhu, Assistant Professor of Biomedical Data Science and Computer Science and Electrical Engineering at Stanford University, Svetlana Lazivnik, Professor of Computer Science Department at University of Illinois at Urbana-Champaign, and Deva Ramanan, Professor at the Robotics Institute at Carnegie Mellon University. And so today I'd like to introduce you to our featured speaker, Mihaela van der Schaar, the John Humphrey Plummer Professor of Machine Learning, AI, and Medicine at the University of Cambridge. Mihaela is a Turing Fellow at the Alan Turing Institute in London, where she leads the effort on data science and machine learning for personalized medicine. She has many awards, including an and recognition, including an IEEE Fellow and other prizes in preventive medicine that she has received for her work, as well as the NSF Career, IBM Faculty Awards, and other awards, and over 35 patents. So Mihaela, please, the floor is yours.
Thank you very much. Thank you very much for the introduction, and thank you for inviting me to come virtually. You may not know, since you probably are new to Boston University, but I actually visited almost a decade ago, if not more, your department, and I gave a talk in person at the time. So it's unfortunate somehow that today I need to be virtual, but I look forward for the third time when I'm visiting to be in person again. Can you see my slides well?
Yes.
Perfect. So I'm going to tell you today about time and why and how I believe that this represents a next frontier in machine learning. But before I start, I'd like to really set and talk about the current stage in AI. In the past few years, we have seen a significant advance in AI with the emergence of generative AI, ChatGPT, but also in robotics and Apple Watches using AI, etc. And yet, despite these enormous leaps in AI, we have not seen a true transformation of healthcare systems. For instance, AI has not fixed issues with the National Healthcare Service here in the UK, or enabled us to control the exorbitant costs of US healthcare. Also, can we really prevent traffic jams from happening using AI or solve the energy crisis? And if you are an educator like I am, you may wonder, has that much changed in 2000 years since Romans were educating young people in their classrooms? And I really believe that we are not just a few breakthroughs away in solving these real-world challenges. Note that I'm not saying that machine learning cannot solve these challenges or cannot play a role in these real-world domains. Rather, what I'm trying to say is that often, in order to solve such big challenges like the one highlighted here, which are big and complex, we need to think differently about machine learning and orient it towards solving the complexities of this real world. And I'm a professor now for 20 past years, And over the 20 years that I've been a professor, I've worked on numerous areas. I developed machine learning techniques and other techniques for a variety of domains, from smart cities to finance, from transportation to energy grids, and more recently to two domains that I'm very passionate about, medicine and education. And I really believe that solving these complex human-centric problems in any area that I highlight here is really our biggest task as AI researchers, rather than just developing the next tweak on a particular architecture. Rather, engaging with these real complex domains and trying to use AI to address these challenges. And I do think that this requires a fundamentally new paradigm to orient AI towards being able to even address these complexities. And for that, I have written a year ago a manifesto paper, which I called Case for Reality-Centric AI, and which you can find on our website prominently displayed, where I outline agenda and what I think is needed if it is for us to solve bigger problems, human-centric problems using AI. I'm not going in view of time to go into the details, but let me just say that what I focus on is AI which is able to solve such real problems, that deals with the inherent and unavoidable complexities of the real world, rather than just standardized problems like we often deal in machine learning. We have a benchmark and a toy problem in this benchmark, a particular maze or a particular toy setting. And on the basis of this toy setting, we are improving again and again with little algorithms, rather than really looking at the real world, trying to understand why certain issues are not addressed and try to correctly model them and engage with them. So a shift in paradigm, a shift in lens, and also very important to me, we build AI that is human empowering rather than human replacing. So really trying to understand how the technology they are building, it empowers humans. And I really feel that this reality-centric agenda is both very important, but also requires a new way of thinking. And if you want to hear more about it and discuss more, not only with me about this agenda, but also with my students, we started in the pandemic more than 3 years now, 3 years ago, a set of engagement sessions that are online that you can come and join us for. They are happening every month. You can see past sessions online on many topics. The one that we are going to have on February 15th at 4 p.m. UK is going to be on very innovative uses of large language models, not the conventional prompting paradigm. So I hope you'll come and join us. But today I'm going to talk about time, and I find time very exciting, and time is very important in all the areas that I highlight, not only medicine and healthcare. Let me start with a little metaphor. What you see here is a beautiful painting that's currently just has been restored, and you can see it at the National Gallery in London. What you see in this, you see the story of David and Goliath, but you see how this Renaissance painter started to really paint this story. And since he didn't have a video, he just had a canvas, he tried to portray David in different sections of this panel. So you see him at the very beginning, you see them a little bit later, you see them, I don't know if you can see my screen, you see them later again, and then you see Goliath here for the first time with some, bleeding on his head. And also you see Goliath on this other, it seems almost anachronistic moment, down, he's now down, he's dead, and David is cutting his head. So you see a story being told over time, but actually you see that this is anti-causal. So you see that you go first in the future and then you go to the past. So what's very interesting is artists have struggled with this idea of convening time in a picture for a long time. And I feel it is time for us, the machine learners in the 21st century, to also rethink how we think about time, because often we just think about it as another feature or in simplistic ways. So this talk is motivated to tell you a little bit about my way of thinking, what we have done as a lab, but also things that remain to be thought about. And you see here some recent work from iClear 2024. And if you look at the type of works we are doing, almost every one of these works, the first, the second, the third, the fourth, the fifth, the sixth, the seventh, all of them are actually focusing on different aspects of time series, whether it's transparency, whether it's diffusion models, whether it's causality, whether it's building and generating something using large language models, whether it's determining expertise of a human changing over time. So time is actually very interesting and important in our lab. But today I'm going to tell you about a few aspects only of our work. I'm going to start by talking very briefly, just to set the scene, about early warning systems. Then I'll talk about early diagnosis, and then I'm going to talk about causality over time. And from that, I'm going to argue that causality is not the ultimate frontier. What is the ultimate frontier is understanding change as in complex dynamical systems. In the end, whether it's the human body, a city, or a financial system, it's a complex dynamical system that we need to understand in order to be able to unravel and act upon. And this has numerous domains, not only healthcare. So while my examples may come from healthcare, the ideas transcend it. So let me start with early warning. So often the goal here would be to see if we can foresee a potential issue or risk in a system, and we would like to do that in a timely manner before it occurs. So you see here, for instance, a data set that we often use in machine learning, and it's a data set acquired in Boston, and it's actually the MIMIC data set, the Harvard data set, which you have different types of measurements taken over time. And on the basis of these observations, we would like to do a variety of things. One of the most interesting things we would like to do is to do time to events. We would like to predict on the basis of information that we have when events of interest will happen. So we have longitudinal data, and we have different types of events of interest. The person is put on a ventilator. The patient is discharged from the hospital, is discharged from the ICU. Different types, or has a heart attack. Different types of events are happening. Also, we deal with censoring because some of these patients disappear and we do not know what has happened to them. So for instance, they've been discharged and we don't know whether they were discharged and died 2 days later. Okay, so what we like to do here is we would like to use longitudinal data, not to predict the next biomarker, which is boring, frankly. So I don't want, give an observation, predict the next one. That's boring. We want to predict something important, a next event of interest, and when it will happen. So this person may have a heart attack in 2 minutes, or in 5 days, or never. So we really need to compute time to event dynamically on the basis of the observational data. And this is a challenging problem. And one other reason why this is a challenging problem is not only the fact that we need to predict the label and the timing for this, and we need to learn from sensor data, but also because there are multiple competing risks. And this is, again, very interesting because we are not interested in just one event, but multiple events, and maybe only the first event matters and is the one that we need to pay attention to. You'll say, what's the problem? We have beautiful transformers and many other dynamic and recurrent neural networks. Well, yes, we do, but they are not solving the problem we are interested in when we want to solve early warning systems, because these are not classification or regression problems. What we are interested in, doing time to event. So we want to determine the event, the probability of event, and how this changes over time, which is not something these conventional networks are able to provide. So time series forecasting is about predicting the future values of a sequence, like we often do in transformers. So if I'm interested in what's my blood pressure in the next minute, I could do that. But what I'm hearing more interesting is not what my rate will be at the next moment or my blood pressure, but rather, will I experience a heart attack? And what's the probability of this heart attack changing over time? This is very important. It's actually much more important than many other problems like monitoring, partially because we would like to really understand if events happen in any of these domains and early intervene. So we care about time to event because this allows us to do better planning, to schedule maintenance, to do risk mitigation, to maybe take a medication or do something else, add additional resources. So this is an important challenge and one that people in machine learning for a very long time have overlooked. Statisticians have looked at this, but the machine learning community didn't look at this real world, yet important problem. So what we did a few years back, we developed the first machine learning model that takes time series data and is doing this time to event analysis and is able to estimate different competing risks simultaneously. I'll not go into the details of this. You can take a look. Since then, improvements have been made, but this still represents a big workhorse of time to event analysis over time. And you see here a multitask architecture, but associated with different types of events. But what's interesting here is not just the architecture. The architecture is least interesting. It's just an attention mechanism, and you can put anything you would like, and you have these subnetworks associated with the different events. What's interesting is the loss function, which needs to consider this time to event characteristics, and it's a lot more sophisticated than you would see in conventional transformers or recurrent neural networks. It's not just step ahead. I will not talk about this. If you are interested, take a look at the paper. The reason I want to throw this is to contrast mainly with what will follow. Let me just say, though, that this technology is not just a machine learning paper. Since then, we took it to a variety of real-world applications, also in prostate cancer, in work with Professor Vincent Granapagrasam, who is the professor of urology in Cambridge and a pioneer in cancer prevention and treatment. And with him, we are using this methodology to do active surveillance of patients that have prostate cancer, and we are monitoring them for different events of interest. And depending on that, we are determining when the patient should be coming to the hospital next, to the screening next. And you can see about this discussion and the interface and the system that we have built and which Vincent is now debugging in one of our sister engagement sessions. This time is a session with clinicians. You cannot join unless you are a clinician, these sessions, but you can see them online on our Revolutionizing Healthcare YouTube channel. I talked about early warning because I want to contrast early warning with something that's often misunderstood as being the same thing, but it is not. And this is early diagnosis, where the focus is now really quite different, to detect the existing problem at the earliest possible time. So early diagnosis focuses on identifying an issue that has already emerged, but remains hidden or subtle. And this is true, again, in many different domains. Early diagnosis is important for financial crisis, for engineering, but also very importantly for medicine. And cancer is a very good example. And it shows how important it is to detect cancer early. You see that if you detect cancer at the earliest stage, you have a lot better survival for any of the big cancers. And also importantly, as highlighted here, the type of resources you need to invest in treating successfully the patients are also a lot less, thereby leading to less overburden for the healthcare systems. Yeah, it's tricky because as you see here, this is real data from the United Kingdom, from the cancer registry. You see these different measurements prior to stage 2 ovarian cancer. Unfortunately, many women are not diagnosed prior to stage 2, at times even stage 3 or 4. And you see here stage 2, where the orange line is, and then you see a few events beforehand. And already stage 2 is quite late. So we would like to move this and try to make this diagnosis of ovarian cancer even earlier. But you see, as we move earlier, there are very few events, very few symptoms or signs or information that we have to do our prediction on. So unlike in the previous case, we are not monitoring somebody like in early warning, somebody that's at risk, that we monitor either with prostate cancer or because they're in the hospital or because the economy is at risk. We monitor it and we have enough observations and we can do these events. Here we have very limited information, maybe very, very diverse information, and yet we need to do this early diagnosis. So there are sparse and diverse observations we need to make this prediction from, and it's challenging because, as shown in here, early signs and early indicators may be minimal and may be also very may be informative of other things, not necessarily a cancer event. So they are somewhat ambiguous as well. So can machine learning help? And really here is where I would like to tell you what we have done and ask for your help, the audience, to do better. Because this is a problem really needs our collective brains. So how did we model this? We modeled this by looking at different signs, symptoms, diagnoses, and events of all different types as a dynamic, evolving graph that's personalized to the individual. So what we are going to do is we are going to try to learn the system evolution from few events and try to learn these dynamic graphs for an individual and use them for prediction and forecast. Because if we can learn these temporal relationships between the different indicators, we can learn how the individual, the system evolves, and what we can expect in the short run and in the long run, and when do we expect that to happen. So in this way, we can early diagnose because we see certain things and say, this is not okay. If in a certain time I see something else happening, this may trigger me to do a certain investigation on this individual. So timing as well as the interaction of indicators is important. And we would like to determine what indicator is likely to occur, potentially in what order, and also the timing between events matters and is indicative. We often, when we go to the doctor, they ask us, when did this occur? Did it occur before or after? Is that long ago? Or is it relatively recent? This is all what the clinicians do currently very much in their heads. And what we would like is to unravel the interaction among this indicator over time and learn them from data. So as I mentioned, this hopefully will allow us to do early diagnosis. And the way we learned that in this AI Stats 2020 paper, which is by now somewhat old, but I still like a lot this work, and I think we can improve on, hopefully with your help, is we use deep diffusion models. So this enables us to really learn this dynamic graph and learn the ordering and timings of indicators. So what we learn is a dynamic network, G of T, as highlighted here, consisting of vertices annotated by V, binary labels, LT, indicating if a particular event has occurred or not, a set of directed edges weighted by WT, and these edges link an observed vertex VI to another vertex VJ, and VI modulates VJ's chance of occurrence. And the weights represent the strength of such a modulation effect between these indicators. So how can we learn such a dynamic indicator network from data? Because we do not observe the network directly at each time. We just observe different types of events and the time when they occur. So lying at the core of our learning mechanism is a point process, which is highlighted here, and it has this intensity function lambda VT, which is the probability of event V occurring in the time window T plus delta T. And what I have is I have first this exogenous term, which captures the occurrence of events due to static factors. And for instance, the first one, the exogenous may be some genetic information, things like that. The second one, the second term, is the impact due to the history, due to the past events. And each historical event adds an impulse to the intensity function. So let us see this in here. We have this parametric form highlighted here to capture the impact of past indicators, and the instantaneous impact between VI and V is highlighted here. Sorry. Yeah. Then I have a second term, which is the time influence kernel capturing the decay or increase of previous events influence. And then finally, the dynamic influence factor that depends on the full history of indicators so far. And it can be learned, for instance, by a recurrent neural network or a transformer applied to the past events. Now, what's nice here is that as I'm learning this from data, I can then apply it in action for a particular patient now at when the patient at test time. And I have particular exogenous factor. For instance, how likely is this person to develop a particular event? And then as things occur, as you see on the right side, different types of events are occurring, and the probability of related events is changing. So you see how this is changing now. The probability of event event 2 is changing. And then as this is happening, then the probability of another related event, 3, is happening, and so on. And what you see there is the probability of this event happening and how this is changing as other events have happened. With this in mind, we can learn really dynamic networks, and we have done that in the case of bowel cancer. However, I am not satisfied. I think we can and should do better. We need different ways than deep diffusion models to think about this problem. We also need to deal much more with the irregular and informative limited data that we have. Maybe Hawkes point processes can play a role. Many of the risks factors are correlated, and maybe we can learn more effectively. And finally, how can we use such dynamic networks to identify individualized screening remains also a challenge. And in that context, doing cost-benefit analysis is important. Again, this has many application areas, and depending on the domain, maybe the modeling will need to change, and definitely the data will change. So an area ripe for exploration. But now I'd like to turn and say, let's assume that we can early diagnose. Shall we intervene? How shall we intervene? So can we really now turn the lens and think about interventions? And for that, can we think about causality? So both in terms of understanding what's happening. Here I said this event may trigger another event. I didn't say this event caused another event, but maybe some events are causal. And maybe if I intervene, this will lead to other outcomes. So what causes cancer? How does cancer evolve if we don't intervene? How shall we change this for a particular patient? These are all examples, if you like, of causal questions. And if we know a complete interventional graph associated with this, then we can do causal reasoning. And my former colleague at UCLA, Judea Pearl, has done, and everyone that followed that strand of research led to fantastic research that's very useful and very powerful. But unfortunately, in medicine and in many settings, we do not have such causal graphs. So we do not know the complete causal graph. So the question then is, what can we do? Well, one idea is to do discovery. At times this may be possible, and you will see towards the end of my talk, I'll talk somewhat about causal discovery over time, which is important. But in other settings, we may not even do that. We may not even be able to do that because even if we discover something, we may not be able to know whether indeed this is the true underlying cause and the mechanism has indeed evolved due to these underlying causes. So while the world of causality is a fantastic world and a world we should aspire to, it involves strong assumptions, often untestable. It often neglects the functional form. We say this causes that, but not, for instance, did the fact that somebody smoked one cigarette cause cancer, or is the amount of cigarettes or the amount of cigarettes over time? So functional forms matter. Time is often neglected, and often we think in terms of all or nothing. So what we would like to encourage the researchers is to think a little bit more pragmatically about this. And for that, we introduce a new framework that we call causal deep learning, which is a reality-centric way of thinking about bringing causality ideas to make real-world impact today, while striving for the really complete causal knowledge. And what you will see is that in our case, we allow for flexibility of an assumption. So our assumptions are testable. For instance, as you are going to see, we may have assumptions which may have to do with, for instance, independence. We are going to look at partial causal structure. We are going to very much care about the parametric form, thereby introducing the ability to differentiate between, for instance, linear models and deep learning models. And very important, time. Time will be explicitly considered and very often is forgotten, even it is at the fundamentals of causality. If you read more about that, you can take a look at a paper that we put online more than a year ago, and we are just about to update, that we call causal deep learning. So what do I have in mind? First, really what we would like is no longer to live in the current world of just associations, which is at the left side, or all the way at the right side, complete causal knowledge, because we often do not have that. We want to live and be able to even engage with the intermediate case where we have plausible causal knowledge, which can be tested. For instance, what do I mean by that? Conditional independence, factor graphs, Markov equivalent classes. They all are important tools that can inform our machine learning paradigms. What do I talk about functional assumptions? It is important to differentiate between non-parametric models, noise models, fully parametric models, all the way to fully known functions, and understand what do we really require for a particular real-world problem that we would like to solve. Finally, the issue of time, how to intervene, when to stop intervening, very important questions. So as I mentioned, we have a threefold in our causal deep learning. We have a threefold paradigm. We look at the structural scale, where we look inclusively at plausible causal knowledge. We look at the parametric scale and the temporal scale. And we focus on both causal learning problems, but also causal reasoning, in order to link together different types of methods to be able to address reality-centric problems and make step-by-step as a community progress in solving them. This is useful in many other scenarios, not only in medicine. And you see here a few examples, but examples abound. Let's turn to the example of medicine, which is the one that's most important to me. I have a patient, and this patient was already discovered to have cancer, and maybe was unfortunately diagnosed late, like my own mother, unfortunately. And the question is, when should you treat, and with what type of treatments you should treat this particular person? So given the history of the patient and the information I can extract about her or him from the electronic healthcare record, I can now try to learn and understand what I can do for the patient in front of the clinician. So I'm interested in personalized treatments. And this is challenging because what I have in the data is only factual outcomes. So I only know what has happened given the actions that the clinician have taken. So this data is unfortunately biased, but it's positively biased. It's biased by the expertise of the clinician. If you're interested to hear more about the issue of expertise and issue of bias, we have a very interesting iClear paper that really deals with this issue by Alihan Huyuk. Now, if we have such observational data, we would like to ask questions such as how to treat this patient, when to give treatment, when to stop treatment, and maybe when to switch to a new treatment. And this is a problem that is challenging because contains time-dependent confounders, which bias the treatment assignment in the observational data set. And what are these confounders? They are the patient covariates that are affected by past treatments, which then influence future treatments and outcomes. And what you see here is that we have indeed bias that we need to deal with, and because of time, this is even more challenging. So you see here bias from time-dependent confounders. How to address this problem? One of the works that we have done that to address this issue is work by Ioana Bica from a few years back that we call counterfactual recurrent network. And what we do in this counterfactual recurrent network, or for short CRN, we are using a sequence-to-sequence model that leverages the increasingly available patient observational data to estimate treatment effects over time. So we move from the past to the future sequence, which is what will happen to this person if we treat in different ways. To handle the bias from these time-dependent confounders, which I just talked about, CRN uses domain adversarial training to build balancing representations of the patient history. And at each time step, CRN constructs a treatment invariant representation which aims to remove the association between the patient history and the treatment assignment, such that we can reliably use this to make counterfactual predictions. Indeed, what we are able to show at the time is that by doing so, we can achieve better performance than a variety of other models, including some of our old models and some other models from statistics. But this is just the beginning, and as a matter of fact, we and others went ahead and built on top of this work and improved it. So, for instance, we need to understand what type of assumptions we should make about the data. Often in this type of causal questions, we talk about overlap. Where does overlap come from? Again, I'd invite you to take a look at this recent paper we have at iClear 2024 about expertise, where we talk about that. Another issue that we often care about is really issues that may seem mundane but are very important, such as, for instance, how do we deal with observational data? Because in CRN, we assume that we have observations at every time point, but this is not the case. Information is only sporadically gathered. To deal with irregular sampling, our first attempt has been to use neural ODEs, and we used actually neurally controlled differential equations to be able to address the irregularity. But we soon realized that this is not enough because the timing of observations are not missing at random. They are informatively missing. So in this recent work, half a year ago, together with Ton and Alicia, we started to learn from informative sampling, the fact that we have observations and we don't have observations. And we formalized the informative sampling in the treatment effect problem as a covariate shift problem, as shown in here, and show that it can prohibit accurate estimation of treatment outcomes if we do not properly account for it. So what is interesting here is that we do not learn from the observations, but also from the time from the observation was made, which tells you something about how the patient felt about being treated or not treated. So I think that this is very much the beginning, but an interesting challenge and a real-world challenge. Now, finally, I believe that the ultimate frontier is really thinking about dynamical systems. And what I really would like to say is that while I talked about causal structure and causal deep learning, I feel that the ultimate, let's say, frontier is really learning the governing dynamics of complex systems. So discovering and analyzing complex dynamical systems. That's more challenging than causality, but even more powerful. And if we are able to do that, many other things from causal inference to survival analysis to treatment effect estimation can be solved elegantly and powerfully. In recent work, we have tried to make a bridge between the past way of thinking, the counterfactual recurrent neural networks that I described, and this new way of thinking. So what we try to do is we try to show how, if we have data as shown in the left panel, if you are to do treatment effect estimation, like in the middle panel, a standard treatment effect approach, like for instance CRN, the one that I presented, will learn a representation of the data and will use the representation to inference or to learn the representation of the data D, which will then use for inference. Unlike this, what we are doing actually at the right side, we are learning from data the dynamical system. So we learn an ordinal differential equation describing the data, which is refined for each patient specific, for each patient in the data. So this has advantages in terms of interpretability, irregular sampling, and also we require a different set of identification assumptions that are weaker than what we have had in the past in the causal treatment effect literature. And this introduces a totally new and exciting way of thinking about the area of heterogeneous treatment effects and personalized medicine using ODEs. But this is easier said than done, because how do we learn ODEs from data? This is a challenging problem. If we have observational data, so healthcare data, let's assume, but again, this doesn't need to be medicine. So we have a particular data set of observations, and we need to try to learn from this data the underlying system of ODEs. This is challenging, a very hard problem, which for many years has not been solved. And the reason this is challenging is that time derivative is not observed, and conventional symbolic regression methods are often not applicable. And they are difficult to estimate from data. So naive two-step symbolic regression and methods such as Cindy often fail. And really, to highlight that, you can see these results in here. So you see, for instance, that really the performance of learning from data is very, very challenging because we do not estimate, we cannot estimate effectively the derivative. Yeah, so it's not the data that we interpolate, but rather this derivative. So the right one shows the second derivative, for instance, and the task you see is becoming increasingly harder. So we move from really just having the first derivative, second derivative, and you see things get challenging. Now, there is an additional challenge, and the fact that these patients are not from birth or not from a particular time point. You have observations that start at different moments in time. So estimating from data the initial value problem is challenging. And because of that, even non-opaque machine learning methods, such as neural ODEs, which are not what we want interpretable solutions, but even non-interpretable solutions have big challenges. So this problem is what we attacked in this paper called Decode together with Zhaoji and Christophe. And what we are trying to do here is learn from data, from observational trajectories, closed form ordinal differential equations. How do we do that? We do that using the variational trick, which enables us not to refer to the derivative, but rather using the variational formulation of ODEs to something else. What is this something else? We use this variational formulation of ODEs that enables us to change really the objective. What you see here is that we introduce a functional that is a function that takes the function f, the trajectory x, and the so-called testing function g, which we are designing. And it is this functional which we need to estimate, which is the value of two integrals. And as you can see here, they do not contain the derivative of x. They contain the derivative of g, and g is something we can design, which we as engineers, computer scientists like. And we design it in such a way that we can easily compute a derivative. There is in that particular paper quite a lot of formalism, and this formalism is not really just decorative math. It is used to really define a very powerful loss function, and we are able to prove that minimizing the value function of the functional indeed corresponds to finding better approximations of the true ODE. We use that to build an algorithm, which in the preprocessing step, we take the data of the observed trajectories, we denoise them, we interpolate them to get estimated trajectories. And note that we do not estimate the derivatives, but rather the trajectories, so the problem is simple. And then what we do at the second step is we do now the optimization to be able to learn the system of ODEs and what type of functions we design, what type of functions G we design. We are using the sign basis to be able to do so. And the reason we were able to identify it is that a good basis function is because of the theorems that I described before, which tells us about the class of function we need to search for. This is not the only one. And as a matter of fact, I think we need to investigate as a community what are the best basis functions to come up with the best and most effective algorithm. We show in experiments that you are able in this way to learn from data things we do like we don't know and we try to recover. So we start by generating data of a variety of processes, especially processes that are complex, like asymmetric growth with saturation, for instance, which often happens in medicine. And we compare against a variety of symbolic regression methods. We're able to identify that our probability of successfully identifying the dynamical system correctly is much higher than alternative methods, inclusively in scenarios when we have a lot of noise, limited sample size, and also limited observations. Interestingly, when we have chaotic systems, it's even worse for symbolic regression. And methods such as neural ODEs can't even solve that because they can't solve the inverse value problem effectively. We took this then to some real-world data and tried to see if we can make discovery of dynamical systems from data. And for that, what we did is we used 8 clinical trials on cancer patients and tried to see if we learned the dynamical systems associated with them. And what you see here is that indeed, methods like decode are simpler than the method than dynamical systems as learned by symbolic regressions, which are more complicated and less realistic because you don't see what we usually expect to see in cancer patients, that after a particular, not in all cancer patients, but in specific cancer patients, where initially the treatment is leading to a decrease in the tumor volume followed by a relapse. So this type of trajectory is captured correctly by decode, but not by symbolic regression. Of course, much more analysis needs to be done. And already some of this is part of decode's appendix, but a lot more needs to happen if it is to take this to real world. At this stage, I'd like to finish by asking one more question. What about higher order ODEs and PDs? Because this is really difficult to search and the variational trick may not work. So based on this observation, we propose actually a new characterization of PDEs. So any PDE can be expressed in the following form, where we collect all terms containing derivative into a so-called derivative bound part, so-called derivative bound part, and all the terms without derivatives into a derivative-free part. And the derivative-free part can be evaluated directly from the data, while the previous one, the derivative-bound part, requires access to the derivative. And this is challenging, and we may not be able to always have the variational trick to work. So this is why we are defining a variational-ready PDE, which is a new class of PDEs that we define, which are the broadest class of PDEs that admit variational formulation. What we did is, in a paper called Decipher that appeared at NeurIPS last year, Christophe, together with Zhaoji, developed this framework that we call Decipher, and Decipher is able to go one step beyond decode and not only learn ODEs, but also more challenging PDEs. Please take a look if you are interested. But the reason I'm presenting this is not because it's rocket science math. Christophe is a mathematician, and a lot of new math needed to be developed to allow that. It is not that what motivated us, but reality-centric problems, because while decode can deal with tumor growth, pharmacological models, epidemiological models, and discovery of this sort, Decipher can go one step further and deal with spatio-temporal physical systems and learn them from data and tumor growth and tumor cells evolving over time. So an even bigger and more exciting class of problems. Okay, so this brings me to the very end. I really hope that you are excited about time, especially in the context of trying to understand dynamical systems, because if we are able to do that, we are at the very forefront of analyzing the real world, whether it's the human body, a smart city, or a financial system. And we are just at the very beginning of really starting to explore this exciting but difficult agenda. If you are interested, again, to not only interact with me, but also with my students, we have an engagement session again on the 15th of February at 4 p.m. UK time, where we are going to talk about very innovative ways of using large language models and how can they empower us to get closer to reality-centric AI. Thank you.
Great, thank you so much, Mihaela. Thanks for the really exciting talk and this holistic perspective on real-world AI. We'd like to invite participants to type their questions in the box. We already have a question here. So there's a question on survival analysis. There exist tried and tested old models such as Cox regression. I understand that with neural networks, you are not limited by the linearity assumption of log hazard rate. But does it make a big difference in practice? For classification, for instance, logistic regression can often perform as well or better with good feature engineering as neural networks, and it is interpretable.
Thank you for this question. So the answer is yes, and yes, and yes. So let me start by starting with the first part. So I'd like to highlight here that I talk about dynamic survival analysis. We also looked in our past work on static survival analysis, where we use cross-sectional data to build machine learning models for survival analysis and compare them against, for instance, Cox regressions. I invite you to take a look at work such as deep heat, survival quilts, which are methods that come from our lab, where we use neural networks to do time to event analysis, inclusively competing risks. But what I highlight here, and where the, let's say, the gap between regression models, linear models, and machine learning models is really very big, is for dynamic settings, where I don't have just one observation or cross-sectional data, but I have time series observations. If you have time series observations, what happens in statistics, usually do landmarking, and landmarking as well as joint models, which are the two solutions that the statistical world has provided here, are significantly underperforming as opposed to time series settings where we learn using, for instance, a powerful transformer or a powerful recurrent neural network, but where the loss function, as I highlighted, is like in dynamic deep hit, is one that does account for the survival analysis aspect, meaning competing risks, censoring, and so on. So the answer is yes, usually it matters quite a lot, especially in settings where the longitudinal trajectories of the patients are actually very informative. So then it's not a question of just doing feature engineering. It is really considering this time series characteristics of the patient and how they change over time, which determine the performance of these longitudinal deep learning models. So please take a look at some of this work that we have done in this area. Thank you.
Great, thank you so much. We have time for one more question. There's a question here on whether you have looked at any settings where there's a lot of noise or delay in the timestamps.
Yeah, no, very, very good. This is very interesting. So we looked a lot over the years at this problem, and I'm still not satisfied. I will tell you what we did. And so let's look not only at time and noise, not only time, not only delay, but it is, as I mentioned, informative observations. So it's not only the fact that the information came later, but rather when it came, because that's often informative about the underlying dynamical system. For instance, a human, but it could be a financial system. So the fact that you have observation tells you something usually about the underlying system. In our initial work, when we were doing predictions, for instance, or time to event analysis, we look at not a Poisson point process to capture the timing, but rather at a Hawkes point process. It is often a mistake to just impute, for instance, if you don't have an observation, or to carry forward, but rather you want to keep that information of absence of information and learn from it. And in the treatment effect literature, that's even more exciting. Please take a look at, so the older work that's in the prediction is with my former student Ahmed Allah at ICML 2017. The more recent work is with Alicia Kurt at ICML 2023, and that's in the context of treatment effect estimation. We looked at it, we have some initial results, but we really need more people to look at it. So if you are interested, take a look. About noise, very interesting and important question. We are very excited about this data-centric AI paradigm, where we increasingly shift our focus not only to build more and more machine learning methods, but rather to understand how to deal with bias, how to deal with noise, how to deal with errors in data. And quite a lot happening in our lab on data-centric AI. Please take a look at our research pillar dedicated to it and come and talk to us.
Great, thank you so much. There's one final question if you have time, but I think we're a bit out of time at this point.
Yeah, no problem. No, my time says that I still have 2 more minutes, so no problem.
So 2 minutes.
And I can stay longer.
Sure.
I can stay longer.
No, it's okay. So it says I'm quite interested in the early diagnose topic. Thank you so much for the interesting talk. My question is, since symptoms or signs in the early stages are subtle, how do you distinguish these features from noise, such as technical variations?
This is not so. It's a very important question. So when you have initially vague symptoms, you may have a stomach pain. You may have stomach pain for many reasons. You may have gain loss, weight loss. That could happen for enough reasons. So you are right that one of the biggest challenge we have is the ambiguity of these symptoms. And this is why we chose, but I'm not saying that's the only way, I'm not saying this is the best way. This is why we chose to model what's the probability that if I take one of such vague symptoms, what's the probability of other symptoms happening that are more indicative, and when? You know, so often in medicine, people say this by itself doesn't say much, but watch for certain things. If they happen, then it shows that we are on a journey to something bad. Conversely, if they don't happen in a certain amount of time, maybe you don't need to worry. So this is why we model this dynamic graph using deep diffusion models to model the length in between events and the probabilities between events. Is this the best way? My guess is not, but this is our first way. There may be better ways. Please think about this problem if you are interested in.
It's a tough problem, yes. Well,
It's
thank
a
you so
tough
much.
problem. It's a tough problem. But I think that if we join forces with each other and we start to think about it and we ask good questions like the person that asked this question, then we start to maybe piece by piece understand how to model it, what type of data we need, and really build tools to help clinicians and patients. So reality-centric.
Agreed. Sounds great. Thank you so much, Mihaela. And
Thank you.
thanks everyone for participating, and see you at the next event.
Thank you very much. Look forward to come once in person. Goodbye.